Hello and welcome to Ayur Health and Wellness. I am Dr. T. Govender, and in today's video we are going to be discussing how to manage diabetes with Ayurvedic medicine. The problem. There are over 537 million adults aged between 20 to 79 years of age living with diabetes. This number is predicted to rise to 643 million by 2030 and 784 million by 2045. So diabetes cannot be controlled with modern medicine. It can merely be managed. And long-term use of these medicines are harmful to the body because they contain a lot of unnatural things such as pesticides and fertilizers and so forth. All of the drugs are essentially derived from this type of chemistry. So it is in the best interest of your health to consider natural methods to chronic conditions such as diabetes. So some of the causes. In hereditary diseases, there are usually two contributing factors. A certain defect in the sperm and ovum results in a genetic predisposition to disease. Ayurvedic texts such as the Charak Samhita have mentioned that excessive indulgence by the parents in the consumption of foods or drinks which are sweet can be the main reason for the chromosomal damage to the sperm and ovum. The second factor can be attributed to an intrauterine environment which can negatively impact the development of the fetus due to the mother's diet, her lifestyle, or mental stress. This congenital aspect can trigger the disease process for which there's a genetic predisposition. When it comes to lifestyle factors, a sedentary lifestyle such as excessive sitting, excessive sleeping, sleeping during the day, lack of exercise, and laziness can be some of the causative factors. In terms of diet, excessive intake of yogurt, fish, milk, new grains, food or drinks containing a lot of sugar and jaggery, cold, sweet, liquid, or heavy foods, as well as slimy foods can be some of the causes. In terms of psychological factors, a disturbance in mental health can be caused due to depression, worry, and stress. Some of the premonitory signs and symptoms that accompany this type of disease include excessive sweating, body odor, a need for constantly lying on the bed, sitting, sleeping, and generally leading a sedentary lifestyle, a feeling as if the cardiac region is covered, excessive exudation of excreta from the eyes, tongue, and ears, excessive growth of hair and nails, a liking for cold things, a dryness of the throat and palate, sweet taste in the mouth, and burning sensation in the hands and legs. When it comes to diet, a wholesome diet is necessary to overcome and manage the disease. I have listed a few items here that are very beneficial. The first being barley, which has a hyperglycemic effect along with its potent lipid-reducing effect, and it is the best grain that helps in depleting excess fat while providing essential energy. When it comes to Indian gooseberry, the chemical constituents of amlaki or Indian gooseberry possess an anti-diabetic effect through their antioxidant and free radical scavenging properties. Amla has also been reported to prevent and reduce hyperglycemia, cardiac complications, diabetic nephropathy, and neuropathy. Fenugreek, current research has shown its effectiveness in delaying the onset of diabetes in subjects with prediabetes. Fenugreek powder has been found to be very useful in lowering the blood glucose in prediabetic patients. So some of the other things that are very beneficial include wheat, as long as it's organic, pomegranate, Bengal gram, bitter gourd, garlic, green gram, and pointed gourd. When it comes to lifestyle, from an Ayurvedic perspective, walking first thing in the morning would be very beneficial, say for about 15 to 20 minutes. Pranayam is also very good in terms of it because it helps to control and regulate your breath and flushes out any morbidities from the system. Yoga, in terms of Surya Namaskar, Bhujangasana, and Shavasana, have also been very beneficial. Shirodhara is a type of upakrama in Ayurveda. It is a form of Ayurvedic therapy that involves gently pouring liquids over the forehead. Abhyanga or oil massage is often done with pre-medicated herbs based on a condition, your specific condition. So please do consult an Ayurvedic doctor before taking anything that has been mentioned in this video. The last useful therapy includes Udvartan or powder massage. It is often used for slimming and for obesity. And it can be done daily. So in terms of Ayurvedic herbs, very common and popular these days is turmeric. Curcumin supplementation has demonstrated meaningful effects on glycemic control and positive trends on lipid outcomes in pre-diabetes and type 2 diabetes mellitus. Holy basil or tulsi is a safe herbal intervention that may assist in normalizing glucose, blood pressure, and lipid profiles and dealing with psychological and immunological stress. Gymnema sylvestre targets several of the etiological factors associated with diabetes, including chronic inflammation, obesity, and pancreatic B cell function. One of the last Ayurvedic herbs I've listed here is Tinospora cordifolia or Guduchi. This is a very good source of berberine as well as other alkaloids. It has an endogenous effect on insulin secretion and glucose uptake inhibition. So all of the clinical research that supports the therapeutic effects of these herbs have been listed in the description. So I hope that you have found this video very helpful. Please do get in touch with us to book a consultation, and we'll see you in the next video. Thank you for watching.